The following segment is sponsored by Rocky Mountain Associated Physicians. For decades, Rocky Mountain Associated Physicians has helped thousands of patients achieve better health and quality of life through surgical weight loss and long-term support. Joining us today is Dr. Rod McKinlay. Thank you so much for joining us, Doctor.
Thank you.
It's great to see you. Okay, let's start with the big picture. When you think about success with weight loss, how do you define it for your patients at Rocky Mountain Associated Physicians?
I define it as better health, in a word. Better health, longevity, and quality of life. So when you think weight loss surgery, sometimes people think success should be measured in number of pounds lost, or maybe even BMI points lost, but I just think of it in terms of overall better health and just living better. Living better,
I love that. Now there's been a lot of buzz, obviously, around those GLP-1 medications lately. How do these medicines compare with weight loss surgery, and in what ways are they similar or different?
Right, so that is incredibly popular right now, the GLP-1 drugs, and probably a lot of people are wondering, what does GLP-1 even mean? I mean, it's a hormone or a signal in our body that tells us that we're full or satisfied. So these drugs basically mimic that internal sense of fullness we have after eating.
Ah, okay.
Surgery does the same thing, only does it a little bit more durably. So changes inside of the abdomen that we do through making either a thin tubular stomach or a small pouch helps someone feel more satisfied because they're getting their own GLP-1, that hormone, to rise up in their bodies, and so they're feeling more satisfied after a small amount of food.
Okay, that makes sense. How would you consider and who to be a good candidate for weight loss surgery?
Many people think that it's only for people who are exceedingly overweight, maybe having to lose 200 or 300 pounds, but in fact, bariatric surgery can be very helpful for people if they're 50 to 100 pounds overweight, or maybe 150 pounds, anything where they have substantial weight to lose. They understand what's involved with the surgery, and they're willing to commit to a healthy lifestyle afterwards.
Yeah, I like that, healthy lifestyle afterwards. What are some of the most common types of bariatric surgeries that you're performing, and how do they help patients achieve those long-term results?
Many people have heard of the gastric bypass. That's the surgery that's been around for 60 years now.
Wow.
It's been a long time, and bariatric surgery has gone through a lot of growth and development and acceptance by the wider medical community because its benefits have been seen. So there's the gastric bypass, as well as something called the sleeve gastrectomy. This is where we actually create a thin tube out of the stomach, a little bit less involved of risk as compared to the gastric bypass. And then a surgery not many people know about called a duodenal switch, which is even a little bit more aggressive than gastric bypass, maybe for patients who are trying to lose close to 200 pounds or more.
Okay, and I'm sure when you see like the before, the afters, and like just somebody's, even their mental health and how much happier they are, it's probably very life-changing.
It is amazing, and that's why I love going to work every day, and I just tip my cap to my patients, and I feel like they really are showing signs of courage to take control of their health and have a better quality of life.
Absolutely. Okay, if we want to make an appointment, where can we go for more information, Doctor?
Well, we're on the web at rmap.com, and of course we have a phone number, and people are welcome to just call our practice and set up an appointment.
Okay, you're amazing. Thank you for all you're doing, Dr. McKinlay. Great to see you. Thanks for being here.
Thank you very much.